Hello. This week 4, we are taking a look at Chapter 12, which specifically takes a look at informal assessment. Informal assessment plays a crucial role in that it assists us with valuable information about a client's thoughts, emotions, and behaviors. Unlike formal assessment, which we talk about as standardized tests with sets of questions, scoring criteria, informal assessments are more flexible, tailored to the individual client needs. One common form of informal assessment is observation. We observe a client's body language, facial expressions, tone of voice, all to gain an insight into the client's emotional state at any level of distress. Another informal assessment tool is the use of open-ended questions. We ask open-ended questions to elicit from the client for them to share more about their thoughts and their feelings in a very non-judgmental, supportive environment. Again, this can help us better understand the perspective of our clients, seeing through their eyes and their lens the underlying issues. Informal assessment can also involve the use of self-report measures, journals, mood logs. All these tools and others the client can use to track their thoughts, their emotions, their behaviors outside of sessions, and providing us with a comprehensive picture of the client's challenges and their progress. We talk about informal assessments in terms of them being very subjective, in a way that the techniques are about gathering specific information, and often in a quick way, and that we're also informal assessment is also very non-threatening. Oftentimes it's easy to conduct because we're not in standardized tests. Oftentimes we're paying for those tests. With informal assessment, usually low to no cost. They're easy to administer, interpret, and they continue to add pieces, if you will, to the total assessment process. The types of informal assessment I alluded to and spoke already of observation. We talk about that these in types of assessment provide those insights, right, to help us tailor our approach, but also to elicit information. Informal assessments can involve informal testing, check-ins, observation, as I mentioned, rating scales, questionnaires. We're going to look at the classification methods, the environmental assessment, records, personal documents, and performance-based. All of these can help us not only gather information at the forefront, but can also track progress over time, track changes, identify patterns, assess effectiveness of interventions. Informal assessment and testing can also, for our clients, paint a picture of progress, of accomplishment, right? Which is very valuable to clients in terms of their continued buy-in, commitment, right, investment, and that they are seeing improvements themselves. So I mentioned a little bit ago about, a few slides ago, about observation, right? In that we gather information about our clients that may not necessarily be captured through the self-report of the client themselves in terms of our observation. So we can see them in action, right? We can gain deeper understanding of their behavior within the real life situation. We observe perhaps they're interacting with family members if that's a specific therapy session, and or obviously observations of how they interact with us. Again, as I mentioned a couple of slides ago, it's important in observation that we pay attention to the nonverbals with our clients, their body language, their facial expression, their tone of voice. Pay very much also attention to subtle clues in terms of the client's emotional state. Are they rocking their foot? Are they tapping a finger, right? Different kinds of movement, repetitive movement that we can observe in our clients. We can also notice a certain posture or fidgeting, as I mentioned, indicating that anxiety, that uncomfortableness. Event sampling is a valuable tool in terms of observation. This method involves systematically recording specific events or behaviors that occur over a period of time. So by closely observing and documenting these events, we can gain, again, insight into the client, perhaps patterns. And that can help inform treatment and intervention strategies. One of the benefits of event sampling observation is that it provides a real-time detailed picture, right, of a client's behavior. It oftentimes allows us to see how a client interacts, perhaps with others, or responds to stressors, navigates challenges. So we're tracking events over time. Again, looking at triggers, patterns, right? Anything that might contribute to the client's presenting issues, problems, challenges. Another benefit of event sampling is that it can again be used to measure progress, evaluate effectiveness, because we're able to compare data before and after an intervention. Thus also taking that into account in terms of adjusting treatment plan or interventions. It's very flexible and adaptive. That is a great benefit and advantage of event sampling observation. And it can be tailored to a specific goal or objective. That way we're able to focus in on an area of concern that's most relevant for the client. In terms of time sampling observation, this is a method that involves observing and recording at specific intervals throughout a session or a series of sessions, right? So it's very specific, a time frame, right? And in doing this, we're able to capture, again, we talk about in that real time, providing an accurate holistic view of the client's experiences and reactions. And again, at these predetermined intervals, there are opportunities where we may, through that kind of sampling, again, identify patterns or trends that may not be evident through other traditional methods. Again, time sampling can also be a tool to help us track progress, because we're collecting data at different multiple points throughout the process. Time sampling also can help mitigate, this form of observation is helpful in that it will mitigate biases or assumptions that may influence assessment and treatment decisions. So we are systematically at predetermined intervals able to thereby identify and address any potential blind spots, right, or areas of focus that may have been overlooked. There's an example of we may where there's a combined event and time sampling. So an instructor randomly observes empathic responses from 3 to 5 minute segments of a clinical interview from a dozen students who turned in their camera recordings, right, from their practicum or fieldwork sessions. Rating scales. Rating scales are a standardized way to measure various aspects of mental health. We measure symptoms of anxiety, depression, right, or other psychological disorders. One of the most widely used rating scales in clinical mental health is the BDI, the Beck Depression Inventory, right? Another common rating scale that is used within our field is the GAD-7 for measuring general anxiety disorder. So rating scales are used to assess mental health concerns. They're used to assess substance use disorders. They're used to track symptoms, perhaps of OCD, of PTSD, different kinds of checklists that perhaps track intrusive thoughts, compulsive behaviors, etc. So rating scales. They're very subjective, and it's based upon the rater's judgment, right, of the rater, based on the rater's inner judgment of the rater, whether it's a client doing the rating or we doing the rating. We talk about 2 errors within rating and the use of rating scales. The halo effect. It's a cognitive bias that can cause a perception as rather more positive or more negative than it may actually be. So this bias can occur when an overall impression is more influenced on the judgment of specific traits or characteristics. The halo effect was first coined by a psychologist in the earliest 20th century in his research on social psychology, and that psychologist was Edward Thorndike. We can see the halo effect in various aspects of our daily lives, from perhaps how we view different brands of companies, of products, of services in our life, to how we view celebrities, right, or sports figures. We can experience bias in workplace settings, where individuals perhaps are judged more on their appearance or demeanor rather than their performance. So the halo effect can have significant consequences in decision making because it can lead to unfair judgments and missed opportunities. So to combat this, we need to strive to be aware of our own biases and make conscious efforts to evaluate objectively, right? Another error is the generosity error and the tendency to demonstrate a bias towards portraying being more generous than they actually are. So this generosity error, socially desirable and commendable, there may be this pressure to present in a more positive light. So there's this exaggeration of a level of generosity when completing the rating scale. So this desire to be perceived can lead to responses that aren't necessarily entirely truthful or accurate. And then they compromise the reliability and validity of the assessment results. The generosity error can manifest in different ways in rating scale assessments. There's this concept within it that we talk about as self-perception bias. Again, they can be unintentional. In order to minimize this error, we need to implement strategies that encourage honest, accurate responses. We also want to make sure that there are clear instructions that emphasize honesty and accuracy in rating scales, and that we work and strive towards that non-judgmental environment for the response to be from where the response comes from. Numerical scales are a type of rating scale, often involve assigning a numerical number to indicate the level of a particular behavior, trait, or characteristic, right? Symptom, right? Numerical scales can be very simple, like on a scale from 1 to 10, right? They can be more complex as well. A benefit of a numerical scale is that it's quick and easy, right? A numerical scale example is, I think of scaling questions within solution-focused therapy. And we talk about, on a scale of 1 to 10, what's your confidence level, right? Well, what would, if you said 7, what would it take to you to be to move from a 7 to an 8, right? So numerical scales are more objective. And they don't rely solely on a subjective judgment. So that's an advantage. Another advantage is that they can provide a clear, structured way for a client to respond to a question. Numerical scales also allow for statistical analysis, right? So researchers like numerical scales and numbers and ratings, right? Because then in terms of quantitative, right, this is quantitative information, and that can help us with mean, median, mode. We can analyze the results, draw conclusions, etc. So quantitative data. Numerical scales do have limitations. One drawback is they can be limiting, perhaps in terms of the range of responses. I may interpret a numerical scale differently from you. Likert scales are another rating scale. These scales are named after their creator, another psychologist, Rensis Likert. They're very widely used in fields of psychology, education, business, social sciences, right? So there's a series of statements or items, and we have to rate them based upon our level of agreement or disagreement, right? A key advantage of Likert scale, they are also simple, they're easy to use, easy to administer, minimal effort, they're pretty straightforward to analyze. And again, they provide quantitative data. Another advantage is their versatility, right? They can be used to gather information on a wide range of topics. They can also be adapted to include different response options, frequency scales, importance scales, right? But they don't have their limitations. One criticism is the lack of granularity, right, in the response options. For example, the difference between strongly agree and agree may not always be that clear, right? And that can lead to potential response bias. They're also limited in their ability to capture perhaps more nuanced or complex attitudes or behaviors, right? And so um, a person who's completing it, the client in this case, rather simplifies their responses into these predetermined categories. Semantic differential scales is a series of opposing adjectives or phrases, um, like one end of a continuum and another, and you indicate like where you fall right on this continuum in relation to whatever's being assessed. It's a valuable assessment. It allows for more nuanced understanding of how the respondent, the client, may feel, depending upon what it is that they're being asked to scale. A key advantage is that it can be used to measure both kind of positive and negative, if you will. There's this range of options that capture both ends of the spectrum, as I reference, so that there's a more comprehensive, perhaps, assessment by the use of this type of scale. It does allow for more complex, nuanced attitudes. And it allows for more detailed understanding, perhaps, of the person's attitude towards whatever there is they're scaling. And it can be used to compare towards others and other attitudes towards different aspects of, again, that same type of question that is scaled in that format. Rank order scales. This is used for the comparison of different items in terms of importance or performance or any other relevant factor, right? This provides a clear ordering, right, based upon position. So that makes it easier for the person to understand and interpret the results, which would be us. So a client clearly ranks in order 1, 2, and 3. This type of scale is used again in a variety of settings: education, business, research, etc. There's a variety of different types of rank order scales. They provide that clear, easy to understand way of comparing that helps with the person completing it making informed decisions. It's a useful tool. Again, also looking at patterns or trends, even in conjunction with other assessment tools. Some limitations. They don't provide detailed information about each item other than they're ranked, right, in order. Classification system also plays a role in assessment and testing. By this, we're looking at the complexity of assessments and trying to make it easier to interpret and analyze the results. So there are a variety of types of classification systems that are used, each serving a different purpose and objective. We talk about norm-referenced systems of classification, and they're often used in standardized tests. And we also talk about criterion referenced classification. And that also is often used in terms of how we evaluate a certain knowledge or skill, competency, proficiency. In terms of other, in addition to those two, there are other types of classifications, such as holistic, analytic, behavioral, rubric, all different systems to assess and gather and organize information. Classification systems within assessment and testing do ensure for the validity and reliability of the assessment results. They provide a common language and a framework. One behavioral checklist. This provides a structured, systematic way of observing and recording behavior. So there's a list of specific behaviors that are monitored and evaluated over a period of time. So by using the checklist, you assess the behavior, and then you make informed decisions regarding the classification or the diagnosis. One of the key benefits of using behavioral checklists is they provide objective, consistent data. So by clearly defining and documenting specific behaviors, these checklists provide that standardized approach, if you will, to assessment, thus reducing the potential for subjective bias or any error in judgment. Again, behavioral checklists can be useful in tracking over time. So there's this monitoring, recording. We can see fluctuations. We can look at the longitudinal perspective, effectiveness, again, of interventions, guiding treatment planning, decision making, etc. Feeling word checklists, another classification system. This is a useful tool that provides, again, a way to categorize and understand different emotions and feelings. So this can involve, again, a checklist of various emotions and feelings. And this is a tool, again, to identify and track emotions and can help better understand emotional responses in different situations. A key benefit of using a feeling word checklist is that it really is a great tool in order to assess emotional intelligence, and we talk about emotional regulation, and assess areas of growth. It's a valuable tool for communication, interpersonal relationships. We're able to accurately identify, communicate emotions. Individuals can then better express themselves. So this feeling word checklist classification assessment is a great tool, even for specifically managing stress, managing anxiety, managing anger, right? So checklists or classification methods really, there are so many others that can easily be developed and designed. It just takes our creative imagination. Environmental assessment. So we're talking about environment, the environment in which our client lives or works or socializes. We know that environment has a significant impact on emotional health and well-being. So by conducting emotional assessments, we can identify potential stressors or triggers, as well as sources of support and strength that can influence a client's mental health. It's important then, as we assess through the means of environmental assessment, we can look at different factors. And by understanding then perhaps what contributes to stress, what contributes to coping strategies, what contributes to strengths, what contributes to perhaps the limitations, the risks, the risk factors, right? All from the lens, through the lens of environment. Again, when we think of within the umbrella of environmental assessment, we can look at direct observation. So we're directly observing the client in their natural environment. We have situational tests. So how an individual responds to a certain scenario or situation, that again providing insight into their thoughts, feelings, emotions, processes, coping style, coping skill, etc. We have sociometric instruments within the environmental assessment. We understand the dynamics of the interpersonal relationships, perhaps the social networks within an environment, thus also providing insight into the client's well-being, their mental health. Environmental assessment instruments. There are a variety that, again, can be looked at in terms of different factors that are specific to that individual's environment, perhaps contributing to struggles. Again, looking at perhaps factors that are risks, determinants, issues, challenges, areas of improvement, areas of need. The direct observation can be within a client's home, whatever setting that might be, or a different setting. We have the situational tests, again, those real life situations where we can really see how the client responds. It's usually this role play is a great example, actually. The sociometric, again, what are the dynamics within the environment of the interpersonal aspects of that client, whether it's home, work, family, whatever it might be. The example on this slide is a sociometric mapping at a preschool. Environmental assessment tools, this is an example of one on this slide, and there are many others. Here's another one. This behavior rating inventory of executive function, this is the adult version. The emotional or behavioral disorder scale. So we're looking at the severity of emotional behavioral issues. Then we talk about records, personal documents. So this is, again, we're all that can be looked at in terms of the client. There are different ways of obtaining this information, right? And they all help paint that picture or have contributing aspects or factors that add another piece to the puzzle, if you will. Some common records and personal documents, biographical inventories, autobiographies, journals and diaries. We talk about those with our clients a lot. Genograms is a great example of a rather record personal document type. It's a great assessment tool. We have performance-based assessments tools. Again, they're looked at providing this accurate, holistic view of functioning of our client, whether when we're gaining insights into strengths or challenges or progress. And they can help identify areas where the client might be struggling or experiencing difficulties or challenges. They can also provide that tangible evidence of progress, right? Concrete improvement for the client. Performance-based assessments can be a very powerful tool in promoting client engagement and their ongoing commitment and retention within counseling. Portfolio assessment is a type of performance-based tool. Again, it's looking at a collection of, quote, evidence, if you will, that showcases the client. It's a portfolio that can be a variety of materials that serve to provide evidence of that client, in terms of, again, adding to snapshots of their personality, of their strengths, of their challenges, of their growth, of their support, etc. Portfolios can promote self-awareness, self-efficacy, empowerment, really, in a way that the client is then taking some ownership. Again, they're engaging in a way that's about their learning, their growth, and commitment to their mental, emotional health, well-being, that can be very meaningful and very a commitment to change that's more we talk about more long-term, right? Or the buy-in, if you will. Here's some examples when we look at school counseling specifically for a student. We have the resume, we may have videos of the student's work, assessments from the supervisors, papers, test reports, etc. Test worthiness in terms of informal assessment. When we talk about validity, while formal assessment, we talk about that as the standardized tests have their place, informal assessment also provides another view, a more holistic view, right? And we talk about test worthiness in terms of informal assessments. While one key benefit, of course, of informal assessment in our field of counseling is it helps build rapport and trust with our clients, because we're engaging in a very open conversation, active listening. It helps build that strong therapeutic alliance. Again, as I talked about at the beginning, informal assessment provides us with opportunity to not only observe the client, but then there's assessing the client's strengths, their resources, right? It's a very person-centered approach. Very person-centered approach. Another advantage that I mentioned earlier is that flexibility and adaptability, right? Formal assessments can be very limited, right, in that way. Informal can be very, have more flexibility. But it is important that we make use and are aware of that informal assessments informal assessments can provide valuable insight, but they should not replace any formal assessment. So it's important that we strike that balance between leveraging the strengths of both in our clinical practice. In terms of reliability, again, reliability of informal assessments can be a topic of debate, because informal assessment, we are looking at qualitative information. We talked about the observations, the interviews, the self-reports, the informal tests, right? While, yes, we can gather rich, in-depth information through informal assessment, and the advantages of this, that however the reliability can be a concern, because with formal assessments we have the they're standardized, right? We have the psychometrically sound, right? However, with informal assessments, they lack that rigor, the consistency of the formal, right? So that could raise questions about validity and reliability. So again, it's striking the balance. I mentioned in this earlier in some slides about informal assessments and raising the awareness around potential for bias and the subjectivity, right? So again, informal assessments tend to rely on subjective interpretations and impressions. And there's that risk of misinterpretation, misjudgment, right? And that can lead to inaccurate, incomplete assessment. So again, it's to enhance the reliability, we need to make sure that we're being consistent and being as objective as possible. And again, it's striking that balance. They had some examples of reliability. Cross-cultural fairness. An important aspect to consider when assessing and testing clients from different cultural backgrounds is the impact of cultural values and beliefs. Different cultures have different ways of expressing emotions, right? Seeking help, coping with stress. Those can all influence how they respond to informal assessment methods. So we need to be aware of the cultural differences and adapt our informal assessment methods accordingly. So cross-cultural fairness of informal assessment is language and communication, right? Clients who speak English as a second language or who come from a non-English speaking background, they will face challenges in accurately expressing themselves through informal assessment. So it's important that we make use of interpretation services, that we make use of culturally appropriate communication methods. We need to also be mindful of our own bias, our own assumptions when we're conducting informal assessments. We need to continually engage in ongoing cultural awareness, cultural competency, training, self-reflection, so that we minimize the impact of our own bias on any types of assessment tools and anything that's part of the assessment process. Cross-cultural fairness is essential so that we provide equitable, effective mental health care to our clients from very diverse backgrounds. That we consider cultural values, we consider language, we consider communication barriers, we consider cultural biases, and that we are sensitive and that we are respectful and that we respond to our clients' unique needs and unique experiences. Some more points about cross-cultural fairness. So practicality. We talk about informal assessments providing us with that real-time contextual information, and in that they are more flexible, they're more adaptable, right? And they can help establish that strong therapeutic relationship with our clients. Can help provide more personalized, effective interactions. Clients may feel more at ease and open when it's a casual conversation, or they're engaged in activities and tests and assessments that are less structured, right? Or feel less intimidating, like standardized. This all can help with authenticity and authenticness, right? And they provide valuable in the moment, right, information. It's important that, yes, there's all that practicality, right? And these points that are made in why the practical nature of informal assessment makes them particularly useful. The role of helpers. Again, how can they be utilized in the use of informal assessment? Some of these final thoughts I think I've already made in terms of informal assessment do have questionable reliability and validity. They may not always be cross-culturally fair, but they can add another mechanism for us to better understand our clients. When making important decisions, they shouldn't be used as a standalone, right? It's that striking the right balance. And we have to use them wisely and keep in mind the importance of them adding to the decision that we're making about our clients, whether it's in terms of diagnosis, working with them in treatment planning, and interventions. And that concludes our informal assessment to this chapter 12.